Now here's our reporter, Laura Windsor.
The diagnosis of cancer in a child can be devastating, and for parents to talk about cancer to their child can be an extremely hard thing to do. We spoke with Dr. M. Maitland DeLand, the author of the Great Katie Kate series of books for children, to help make the explanation process easier for a child and their parents.
I wrote the Great Katie Kate series to help children understand serious illnesses and to help families work together. It's the Great Katie Kate explains cancer, the Great Katie Kate explains diabetes, asthma, epilepsy, get in shape. I'm also working on one for cystic fibrosis. And part of the reason I started doing this is because I have been a parent with a child with a serious illness, and then I treat children with cancer. The book simplifies the process, the whole process of perhaps, diagnosing and treating cancer or diagnosing and treating diabetes. And it goes through all the procedure so that a child, a parent, a caregiver, everyone can read it. It's simple and explains everything well. I find children love superheroes. I mean, they love Spider-Man, they love Superman, they love all these superheroes. And so I made a superhero for kids called Katie Kate. And there's really certain points in a doctor's visit that I think create a lot of anxiety for a child. So what I have in my book is I have the Great Katie Kate comes in the room, and then she magically takes the child and they go and they see every procedure that's going to happen for the course of their illness. And I have this fluffy stuffed toy looking thing called a worry wombat, and that signifies the child worrying. And so as the child learns more and more, the worry wombat goes away. They need to be spoken to in a certain way. When my son was diagnosed with type 1 diabetes when he was 4 years old, the endocrinologist spoke to him like he was 35. Hearing that doctor speak to my child and me as a mother, I couldn't believe it. And I thought, this happens to other people and they have to go with it. So that's one reason why I did that, because I have been the parent. I have heard the bad news. Even when my son got epilepsy, was diagnosed with epilepsy, and he said to me, "Mama, I have something else wrong with me?" I said, "No, Andrew, it's just part of your life." And what I tried to explain to children, that having a serious illness doesn't define their life. It's just something they need to deal with. When you have to tell a child about a serious disease, I tell the parents to be very well prepared, to have listened to the doctor and his staff, and to sit and talk to the child about what the process is and that it's an illness like any other illness. And so you take it one step at a time. The other thing that I find is extremely important is to never lie to a child. And sometimes you think you're protecting them, but really you're not. One time I was in a waiting room and a child came out with her mother and she said, "You told me I was going to take a test. I thought it was a written test. I thought they were going to ask me, did I eat a lot of candy? Did I do this?" Well, it was a blood test. So it's really important to be honest. I think support groups are very important. So if they can get into a support group with other parents who have dealt with the same issue, that eases a lot of their tension, I think. That's very useful. And I always tell them, never appear worried in front of your child. Never cry, because you still have to be the parent, the adult. And I think a child's put in a very serious situation, And I think the most important thing is to form a bond so that child likes you, trusts you. That's really the most important quality you can give.
Dr. M. Maitland DeLand gives us more on the Great Katie Kate book series and the Worry Wombat.
I think there's certain tools you can use to make the disease less frightening for a child. I think walking through the procedures by reading my Katie Kate superhero book helps them because they look at everything. They look at going to the lab. They see that you have to stand up for an x-ray. I think a lot of it is making it more of a challenge instead of making it a medical procedure. Now, when somebody's going in for something like radiation treatment, I think the important thing, I sit on the table with the child. I let them sit up there and their parents are there. If they're maybe 6 or 7, I let them use the controls and move the machine back and forth. And I always say, wow, are you sure you haven't done this before? How could you do that? That's really great. Children like to be feeling a little bit in control. We all like to be in control. And when they're in an illness situation and things are out of their control, if you can brag about something that they can accomplish during, treatment or anything, they love it. So I think it's encouragement helps the child through everything. The great Katie Kate is a superhero who helps children, because when children have this diagnosis, they start to worry. And so Katie Kate takes them through the path of treatment and helps them understand. And as they understand their worries, which is symbolized by the worry wombat, they ease up. And as the child learns, they regain their confidence. My books are available at Amazon.com, at Barnes & Noble, at DeLandBooks.com, and in local bookstores they can be ordered.
This superhero saga can provide an entertaining and indispensable tool for parents and medical professionals who are seeking a positive way to set young cancer patients on the road to recovery by helping them deal with their fear. For the American Health Journal, I'm Laura Windsor.